I'm Dr. Ian Manion. I'm the Executive Director for the Provincial Centre of Excellence for Child and Youth Mental Health at the Children's Hospital. Friends also know their friends. You're looking for a change in behavior. It might be a change in appearance when people are not paying as much attention to their appearance. It might be that they seem more despondent, they seem to be more down. They might start to pull away from friends or pull away from activities they used to enjoy. They may be having trouble with their sleeping or eating patterns. They may become more irritable than they were before. And you might see things like their performance decreasing. Academic performance or performance in organized activities might change. They may not just even be as interested in any of those things. And then you have some very, very clear signs where young people start making comments about how they can't cope anymore, how things are just too tough. Sometimes they'll say, I don't want to go living anymore. Or they might even make things like, what would happen if I killed myself? Sometimes people are afraid that comments like that are just comments or attention seeking. For someone to be looking for attention in that way means there is something wrong. You can talk about these things, but creating an environment where you can have that conversation is even more important. Where you're taking the time to listen, to know what's going on in your young person's life, to check in at least on a weekly basis in terms of how things are going, what's going well and what's not going well. And if there does seem to be something that's of concern to you, you can express your concern. I'm worried about you. Is there something going on? Are things really bad right now? How bad are they getting? What kinds of things are you feeling and thinking when they get that bad? And then stop and listen. Even if the young person doesn't answer for a while, sometimes the silence gives them an opportunity to answer you. And then they can feel heard because you're not filling every silence with your own concerns. It's important for parents to know that there are solutions to these problems too, and not to freak out when their young person starts talking about difficulties. The goal of the parent is to try to be an extra bridge to appropriate supports. And that means the parent sometimes has to face their own stigma around mental health concerns. Concern that maybe someone else might find out that the family isn't perfect, or there are issues in this family. It's more important to save the young person than to save the reputation of the family. It's more important for a peer who hears about this to save the friend, even if there's a danger of losing the friendship. As a parent, you start building open communication from the minute your kids can talk. So you want to make sure that any topic is okay to talk about. You don't talk about suicide with the 2-year-old, but you sure can talk about tough feelings and when they are feeling stuck, or when they're angry, or when they're sad, and what they do and what they can do. And to make it okay to talk about good stuff, but also okay to talk about the not so good stuff. And that to show the young person that no matter what curve you throw them, no matter what issue that comes up, you can still listen to it and you can still talk about it in a non-judgmental way, and you're still going to be there. So when the situations get tougher and the concerns about being able to cope get tougher, and maybe the conversation turns to very unhealthy ways of coping, you can talk about that too. And parents have a huge responsibility, but also a huge opportunity. And it doesn't start when your young person is in crisis. The best way to work to decrease the risk of suicide is to promote good mental health. So where there's an opportunity for young people to have good self-esteem, to feel good about themselves, to feel part of something that's important in their lives and meaningful, whether that's a family or an organized activity, where are their healthy relationships? Healthy relationships with family members, with parents, but also healthy relationships with peers and other adults outside of the family. Anything that promotes good problem solving, a sense of positive self-worth, a sense of belonging, all those kinds of things really help young people face the bumps and bruises along the way. And when they do hit a very tough situation, or when they're suffering emotionally because they may have a mental illness, they have more skills and more ability to cope effectively